What if I told you that the little pill you take every night to sleep better could be slowly erasing your memories and increasing your dementia risk by up to 50%? Hello, my beautiful community. I'm Dr. Katalyn Cari, and before we dive into today's life-changing information, I need you to do something for me. If you care about protecting your brain and the brains of everyone you love, please hit that like button right now, subscribe to our channel, and ring that notification bell. We're building a community of health-conscious individuals who refuse to accept preventable diseases as inevitable. Your engagement helps us reach more people who desperately need this information, so please don't skip this step. And I absolutely need you to share this video with your family and friends because what I'm about to reveal could literally save someone's memory. Now, let me ask you something personal. Do you or someone you love regularly take medications for sleep, allergies, anxiety, or pain? Have you noticed any brain fog, difficulty concentrating, or that frustrating feeling when a word is right on the tip of your tongue but you just can't grasp it? If you're nodding yes, please stay with me because today we're going to talk about something your doctor might not have told you. A groundbreaking 2024 study published in JAMA Neurology has confirmed what many researchers have suspected for years. There's a dangerous connection between certain common medications and brain shrinkage that can increase dementia risk by up to 50%. These aren't rare, exotic drugs. These are medications that millions of people buy over the counter, thinking they're completely harmless. Today, I'm going to walk you through the 5 most dangerous medication categories that could be silently damaging your brain. More importantly, I'm going to teach you about something called the anticholinergic burden scale, a secret scoring system that scientists use to measure brain risk. By the end of this video, you'll know exactly how to protect yourself and your loved ones from this preventable tragedy. And I promise you, the #1 medication on our list is going to shock you. It's something that millions of Americans use regularly, thinking it's completely safe, but it carries the maximum risk score for brain damage. Before we continue, please tell me in the comments, what part of the world are you watching from? And do you or someone you love use sleep aids, allergy medications, or anxiety treatments regularly? I read every single comment because this community means everything to me, and your stories help me create content that truly serves your needs. Let me start by explaining what makes these medications so dangerous for your brain. We're talking about a class of drugs called anticholinergics, and understanding this term could be the key to preserving your memory for decades to come. Think of your brain like a sophisticated communication network. For your memory to work properly, your brain cells need to talk to each other using a chemical messenger called acetylcholine. This is your brain's memory molecule. Without adequate acetylcholine, you can't form new memories, recall old ones, or maintain focus and concentration. Your body makes acetylcholine from a nutrient called choline, which you get from foods like eggs, especially the yolks, liver, fish, and vegetables like broccoli and cauliflower. Now, here's where it gets scary. Anticholinergic medications essentially block this crucial brain chemical. They shred the very foundation of your memory and cognition. The result? That brain fog you've been experiencing, those moments when you can't remember someone's name, or when you walk into a room and forget why you're there. Your most important thoughts are literally being hijacked by these medications. But here's what's even more frightening. Recent neuroimaging studies are revealing the dark truth about long-term anticholinergic use. The chronic blocking of acetylcholine doesn't just impair communication between brain cells, it appears to increase brain inflammation and, most alarmingly, may accelerate the accumulation of beta-amyloid plaques, the same plaques that are the hallmark of Alzheimer's disease. A 2025 study published in JAMA found an even stronger association between these medications and vascular dementia. This suggests the damage mechanism might be twofold. Besides sabotaging neural communication, these medications may be contributing to inflammatory and vascular changes in the brain, impairing blood flow and damaging the small blood vessels that keep your brain healthy. To measure this damage, scientists created the anticholinergic burden scale, or ACB, which scores medications from 1 to 3. The higher the score, the greater the danger to your brain. And here's the critical part that most people don't understand. These scores add up. If you're taking multiple medications with anticholinergic effects, you're not just adding risk, you're multiplying it. Now, I want to make this personal for you. Before I reveal our top 5 list, I'm going to challenge you to do something that could save your memory. I want you to pause this video and go get your medicine cabinet. Bring all your medications, supplements, and over-the-counter drugs. We're going to do a brain safety audit together. Here's a crucial tip. Ignore the brand name on the front of the package. Marketing names don't tell you about brain risk. What you need to look for is the active ingredient or drug facts section, usually in smaller print on the side or back of the package. That's where you'll find the real culprit. For each medication I mention, I want you to check if you have it and note the risk score. Are you ready? Let's start our countdown. Number 5. Medications for urinary incontinence. Many medications prescribed for overactive bladder are potent anticholinergics. They relax the bladder muscle by blocking acetylcholine throughout your entire body, including your brain. Millions of people use medications like oxybutynin, sold under brand names like Ditropen, to control bladder problems. These medications are effective for their intended purpose, but they carry a maximum risk score of 3 on the brain safety scale. If you're currently taking one of these medications, please don't panic and don't stop taking it without medical supervision. Instead, have a conversation with your doctor about safer alternatives like marijuana, which has a brain risk score of 0. Or discuss non-medication approaches like pelvic floor physical therapy and Kegel exercises. But here's the thing, there's no point in protecting your brain from bladder medications if you're still using something much more common for an everyday problem. Which brings us to number 4. Number 4, medications for stomach cramps and irritable bowel syndrome. Do you know that famous medication for stomach cramps? Many of these work as antispasmodics, relaxing intestinal muscles by blocking acetylcholine. The most common is hyoscyamine, found in medications like Levsin and Bentyl. The active ingredient, scopolamine or hyoscyamine, works by relaxing your muscles. The problem? It also relaxes communication in your brain. These typically carry a risk score of 1 to 2. That might not sound like much, but chronic use is like a constant drip of brain risk. For irritable bowel syndrome, talk to your doctor about safer alternatives like peppermint oil, probiotics, dietary changes, and most importantly, stress management techniques. If you were surprised that a simple stomach medication could be a brain risk, wait until you see our next category. This is where the conversation gets more serious, because we're talking about medications that millions use for mental health, and some carry the maximum danger score. Number 3. Certain antidepressants and anti-anxiety medications. Older antidepressants, particularly from the tricyclic class, have strong anticholinergic activity. Medications like amitriptyline and clomipramine, and even some allergy medications like hydroxyzine, are extremely potent and have sedating effects. All of these carry a risk score of 3, the maximum on our danger scale. Now, I want to be crystal clear about this. Never stop a psychiatric medication on your own. Mental health is just as important as brain health, and stopping these medications abruptly can be dangerous. The good news is that there are modern alternatives, like sertraline, escitalopram, and vortioxetine, with 0 anticholinergic risk. For anxiety and insomnia, trazodone is an option with minimal or no anticholinergic effect. The key is working with your doctor to find the right balance. We've talked about bladder, stomach, and mental health medications. But what about that back pain? The muscle relaxer you're taking might be doing the exact opposite for your brain. Number 2, muscle relaxants, cyclobenzaprine, sold under brand names like and Emrix, is one of the most commonly used muscle relaxants in America. The drowsiness it causes is a clear sign of its action on your brain, and it's not a gentle action. This medication carries a risk score of 3, the highest on our danger scale. Taking it occasionally for acute injury might be acceptable, but chronic use for ongoing pain is where the real danger to your memory lies. The foundation of chronic pain management should be physical therapy, strengthening exercises, and safer pain relief options. We need to treat the cause, not mask the pain with a brain-sided medication. If you found that concerning, prepare yourself. We've reached number 1, the champion of hidden brain danger. This is the one I promise would shock you, and it's the most dangerous for one simple reason. Everyone thinks it's completely harmless. Number 1. The harmless medication that poses the greatest risk. We've reached our number 1 most dangerous medication. And it's dangerous not because it's the most potent, but because it's the most common, accessible, and underestimated brain threat. I'm talking about diphenhydramine and dimenhydrinate. You know these by their brand names? Benadryl and Dramamine. Yes, the same Benadryl that's in every pharmacy, every grocery store, and probably your medicine cabinet right now. Both are incredibly powerful anticholinergics with a maximum risk score of 3, and they cross your brain's protective barrier with frightening ease. That's why they make you so drowsy. Taking Dramamine for travel sickness, fine. Using Benadryl occasionally for severe allergies, acceptable. But taking just half a pill every night to help you sleep? Absolutely not. You are literally giving your brain a daily dose of one of the greatest dementia risk factors we know. And what's truly tragic is that most people doing this think they're just using a harmless sleep aid. What are the safe alternatives? For allergies, use modern antihistamines like loratadine, or these have a brain risk score of 0. For sleep problems, we need to investigate the root cause. Consider melatonin, magnesium, and proper sleep hygiene. Don't use a sledgehammer to swat a fly, especially when that sledgehammer is aimed at your own brain. Now, here's the most critical point that almost no one understands. Did you find a stomach medication with a score of 1 in your medicine cabinet? Maybe a muscle relaxant for back pain with a score of 3? Your risk isn't 1 or 3. The risk's ADD up. In this example, your daily anticholinergic burden is for studies are clear. A total score of 3 or more, maintained for an extended period, is strongly associated with brain damage and increased dementia risk. It's like taking a small dose of poison every day. One dose might not harm you, but the sum of multiple doses from different sources over time creates a cumulative effect that multiplies the danger. This is why a complete audit of your medicine cabinet is so vital. Let me tell you a story that might sound familiar. Imagine your Uncle Robert, a 78-year-old man who's always been sharp and active. But lately, he's been more forgetful. It started with small things. Car keys, the name of a favorite actor, where he put his glasses. The family jokes that it's just getting older, but Uncle Robert also has stubborn insomnia. Every night for years, he's taken just one little pill to help him sleep. No one ever connected these two things. No one imagined that the medication helping him sleep could be systematically undermining his ability to remember what he had for breakfast. Uncle Robert's story isn't fiction. It's playing out in thousands of American homes right now, silently and tragically. Here's the most shocking statistic of all. Researchers estimate that approximately 10% of all dementia diagnoses can be directly attributed to the use of these anticholinergic medications. Think about that. This is comparable to other famous risk factors like high blood pressure and diabetes. This means that 1 in every 10 cases of dementia could potentially be prevented. This brings us to one of the most powerful principles in health, the principle of intelligent substitution. This isn't about going without treatment or living in fear. It's about upgrading your health care. It's about replacing solutions that extract a hidden price from your brain with alternatives that solve your problems safely. At your next doctor's appointment, ask this question. Doctor, what's my anticholinergic risk score? How can we apply the principle of intelligent substitution in my treatment plan to protect my brain while still addressing my health needs? Now that you know what to avoid, the golden question is, what should you do to protect your brain and boost your memory? I've created another video specifically about the best supplements and strategies for brain health, and I'll link it in the description below. Your brain deserves the same protection and care you give to your heart. But remember, knowledge without action is just entertainment. I need you to take what you've learned today and use it. Check your medicine cabinet, have that conversation with your doctor, share this information with someone you love. You know what means the world to me. When someone tells me that something they learned in our community helped them or their family, that's why we're here. That's why I spend hours researching and creating these videos. We're not just a YouTube channel, we're a family committed to taking control of our health. Before you go, I have one final request. If this video opened your eyes to something you didn't know before, please show me by hitting that like button. It tells YouTube that this information is valuable and helps us reach more people who need it. And please subscribe to our channel if you haven't already. We're building something special here. A community of people who refuse to accept that memory loss and cognitive decline are just inevitable parts of aging. When you subscribe and turn on notifications, you become part of a movement that's changing how we think about brain health. Leave me a comment and let me know. Did you find any concerning medications in your medicine cabinet? What questions do you have about protecting your brain health? I read every single comment, and your questions often inspire my next videos. Thank you so much for being part of our community. Thank you for caring enough about your health to spend these minutes with me. Until our next video together, keep taking care of that beautiful brain of yours. I'm Dr. Katalyn Cari, and I'll see you soon.